patient might be placed on a ventilator for a number of reasons. It could be as simple as an elective surgery and as complex as a life-threatening illness or a life-threatening trauma. When placing someone on a ventilator, if we are doing that here in the ICU, we have a multiple number of different coworkers that would help facilitate that. The patient's bedside nurse, and often a second nurse would come in and help. We would have a respiratory therapist like myself and probably a second respiratory therapist just to help with equipment. And then of course we have physician and sometimes a nurse practitioner or a physician's assistant. We would put an endotracheal tube into the patient's mouth, through their vocal cords, and down into the trachea. Once that's in place, we would confirm that it's in the proper position by getting a exhaled CO2 reading, and we listen to breath sounds on both sides of the chest, and then we would get a chest x-ray just to confirm everything is where it needs to be. The ventilator works by delivering pressurized, oxygenated air that helps do the work of breathing for the patient so that they can rest and let their body heal, and we can manage the breathing. The amount of time a patient can be on a ventilator is very variable. It can be as quick as to recover from the effects of anesthesia from a surgery, or as long-term where they would need to go to a skilled nursing facility and continue to get stronger and healthier and eventually wean from a ventilator at a nursing facility. While our patients are on a ventilator, we actively make sure that all their vital signs remain stable. So that's a big job for the bedside nurse to manage, and also the physician oversees any medications that might be needed to help keep those vital signs stable. Your respiratory therapist will optimize the ventilator and make sure that the breathing the ventilator is doing is matching what the patient needs. And we want to make sure that our patients are comfortable and at an optimal level of sedation so they don't feel any pain and they're not anxious about that process. We assess the readiness of a patient to come off the ventilator every day. Every morning, the nurse will do a sedation trial where we wake our patients up slowly. Once they're more awake, we take down the level of support the ventilator gives them, and we let our patients do more of the work of breathing themselves so that they can work on strengthening their respiratory muscles so that the tube can come out and they can breathe safely. The recovery process from being on a ventilator is very individualized to each patient. We do lots of exercises with physical therapy and occupational therapy, and sometimes we do breathing exercises just to help strengthen the respiratory muscles. Our goal as a team with patients on a ventilator is to help them recover from whatever ailment placed them on the ventilator. We work really hard to make sure that they recover in a timely manner and that they come off the ventilator safe and stronger than before they came on.